Low-income postpartum women, a vulnerable population. For low-income women, what should be the joyous occasion of welcoming a newborn into the world is often an overwhelming challenge. Imagine bringing your newborn home and not knowing how you're going to pay for your next meal, keep the electricity on, or keep your job after delivery. You received some supplies like diapers and formula from the hospital, but you know they won't last very long. You feel overwhelmed, anxious, exhausted, and irritable as you try to adjust to parenthood. You must adjust to body changes, breastfeeding demands, sleep deprivation, changes to partner relationships, and the loss of personal time. In addition to the stresses of new parenthood, women of low socioeconomic status face health disparities, including barriers to child care, medical care, mental health care, and continued follow-up. Low-income postpartum women are a vulnerable population for various reasons. According to Davila, women who cannot depend on the support of family members during and after delivery, who are the only caregiver of children, or who have limited resources like food, transportation, and affordable and comprehensive health care, are at a higher risk for outcomes associated with postpartum depression. Postpartum depression is a common mental illness adversely affecting maternal and child health outcomes. Risk factors of postpartum depression include low socioeconomic status, lack of social support, history of depression, prenatal depression or anxiety, and others. Numerous studies have demonstrated that depressed mothers exhibit lower parenting self-efficacy, less responsiveness to their child's cues, and less positive emotion when engaging with their young children compared to non-depressed mothers. In the United States, the most common perinatal medical condition is major depressive disorder, affecting between 10 to 20% of pregnant and postpartum women. Perinatal major depressive disorder is associated with a higher incidence of preterm delivery, preeclampsia, low birth weight, poor or absent maternal-infant bonding, and suicide. According to Kramer and colleagues, during the postpartum period, Black, Indigenous, and patients of color are less likely to be screened for depression, to initiate mental health treatment, to receive postpartum mental health care, and to receive treatment such as a second visit or a prescription refill, compared to non-Hispanic white patients. In a study by Cracked and colleagues, researchers found that Black and middle to low-income women had higher rates of depressive and anxiety symptoms relative to their white, high-income counterparts. Women experiencing housing insecurity and employment-related stress experience higher rates of mental health concerns. Mental health comorbidities are common in low-income urban and rural populations, but the rates at which doctors and advanced practice providers refer patients to mental health services are low. Advanced practice nurses can help low-income postpartum women at the local, state, and national level. In the clinic or hospital, advanced practice nurses can increase screening for postpartum depression and increase the availability of mental health prevention and treatment. Communities can expand programs such as postpartum support groups, parenting classes, and formula and diaper assistance. Because paid family leave is not a guarantee in the United States, postpartum women may lose their jobs and subsequently their health insurance. At a state and national level, advanced practice nurses can advocate for preserving the Affordable Care Act, Medicaid expansion, paid family leave, affordable child care, and improved social services for low-income women. By doing all of these things, we can create a system where women feel more supported in their postpartum journey. Now imagine you are sent home from the hospital with your newborn. While you may still be alone and scared, you are resilient. You are armed with community resources such as parenting classes, new mom community support groups, community diaper drives, and resources for food and formula. You are looking forward to your follow-up appointment with the hospital social worker and your OBGYN who will continue to support you through this transition into motherhood. Every woman, regardless of her income, can receive comprehensive, high-quality postpartum care.